Antihelminthic drugs. Introduction to antihelminthics. The helminths comprise two major groups of multicellular worms that evolved from a common ancestor some 600 million years ago and diverged into two rather different groups. The nemathelminths, nematodes, roundworms, and the platyhelminths, flatworms. The latter group is subdivided into the trematodes, flukes, and the cestodes, tapeworms. Almost 350 species of helminths have been found in humans, and most colonize the gastrointestinal tract. Helminths have a complex life cycle, often involving several species. Infection by helminths may occur in many ways, and poor hygiene is a major contributory factor. Many enter by mouth in unpurified drinking water or in badly cooked meat from infected animals or fish. However, other types can enter through the skin following a cut, an insect bite, or even after swimming or walking on infected soil. Humans are generally the primary, or definitive, host for helminth infections, in the sense that they harbor the sexually mature form that reproduces. Eggs or larvae then pass out of the body and infect the secondary, intermediate, host. In some cases, the eggs or larvae may persist in the human host and become encysted, covered with granulation tissue, giving rise to cysticercosis. This is characterized by encysted larvae in the muscles and the viscera or, more seriously, in the eye or the brain. Approximately 20 helminth species are considered to be clinically significant, and these fall into two main categories: those in which the worm lives in the host's alimentary canal, and those in which the worm lives in other tissues of the host's body. Antihelminthics are drugs that are used to treat infections with parasitic worms. This includes both flatworms, flukes, and tapeworms, and roundworms, nematodes. They are of huge importance for human tropical medicine and for veterinary medicine. Now coming to the classification. Based on chemical structure. Piperazines. Diethylcarbamazine citrate, DEC. Description. An antihelminthic used primarily as the citrate in the treatment of filariasis, particularly infestations with Wucheria bancrofti. Mechanism. An inhibitor of arachidonic acid metabolism in microfilariae. This makes the microfilariae more susceptible to innate immune attack, but does not kill the parasites outright. Kinetics. Absorption, readily. Distribution, widely distributed throughout all body compartments, except adipose tissue. Half-life, 8 hr. Peak plasma time, 1 to 2 hr. Peak plasma concentration, 50 mg dose, 80 to 200 ng/ml. Metabolites, diethylcarbamazine N-oxide. Excretion, urine and feces. Side effects. Itching and swelling of the face, especially the eyes. Fever, painful and tender glands in the neck, armpits, or groin, skin rash. Uses. Indicated for treatment of individual patients with certain filarial diseases, including lymphatic filariasis caused by infection with Wucheria bancrofti, Brugia malayi, or Brugia timori, tropical pulmonary eosinophilia, and loiosis. In cases of onchocerciasis, another common filarial parasite, the drug is effective. DEC continues to be the mainstay for treatment of patients with lymphatic filariasis and loiosis. DEC is also used to prevent heartworm in dogs. Benzimidazoles. Albendazole. Description. Albendazole, also known as albendazolum, is a medication used for the treatment of a variety of parasitic worm infestations. It is useful for giardiasis, trichuriasis, filariasis, neurocysticercosis, hydatid disease, pinworm disease, and ascariasis, among others. It is taken by mouth. Mechanism. Albendazole causes degenerative alterations in the tegument and intestinal cells of the worm by diminishing its energy production, ultimately leading to immobilization and death of the parasite, thus inhibiting its polymerization or assembly into microtubules. As cytoplasmic microtubules are critical in promoting glucose uptake in larval and adult stages of the susceptible parasites, the glycogen stores of the parasites are depleted. Degenerative changes in the endoplasmic reticulum, the mitochondria of the germinal layer, and the subsequent release of lysosomes result in decreased production of adenosine triphosphate, ATP, which is the energy required for the survival of the helminth. Kinetics. Poorly absorbed from the gastrointestinal tract due to its low aqueous solubility. Oral bioavailability appears to be enhanced when co-administered with a fatty meal. 70% bound to plasma protein. Rapidly converted in the liver to the primary metabolite, albendazole sulfoxide, which is further metabolized to albendazole sulfone and other primary oxidative metabolites that have been identified in human urine. Urinary excretion of albendazole sulfoxide is a minor elimination pathway with less than 1% of the dose recovered in the urine. Biliary elimination presumably accounts for a portion of the elimination as evidenced by biliary concentrations of albendazole sulfoxide similar to those achieved in plasma. Side effects. Nausea, vomiting, abdominal pain, headache, or temporary hair loss may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Fever, chills, sore throat, mouth sores, feeling lightheaded, a seizure, or increased pressure inside the skull, severe headaches, ringing in your ears, dizziness, nausea, vision problems, pain behind your eyes. Uses. Albendazole is used to treat neurocysticercosis, infection caused by the pork tapeworm in the muscles, brain, and eyes that may cause seizures, brain swelling, and vision problems. Albendazole is also used along with surgery to treat cystic hydatid disease, infection caused by the dog tapeworm in the liver, lung, and lining of the abdomen that may damage these organs. Albendazole is also sometimes used to treat infections caused by roundworms, hookworms, threadworm, whipworm, pinworm, flukes. Mebendazole. Description. Mebendazole is a synthetic, broad-spectrum antihelminthic. Mechanism of action. The principal mode of action for mebendazole is by its inhibitory effect on tubulin polymerization, which results in the loss of cytoplasmic microtubules. Kinetics. Poorly absorbed, approximately 5 to 10%, from gastrointestinal tract. Fatty food increases absorption. Protein binding is 90 to 95%. Primary metabolite is 2-amino-5-benzoyl benzimidazole, but also metabolized to inactive hydroxy and hydroxyamino metabolites. All metabolites are devoid of antihelminthic activity. Approximately 2% of administered mebendazole is excreted in urine and the remainder in the feces as unchanged drug or a primary metabolite. Side effects. Mebendazole sometimes causes diarrhea, abdominal pain, and elevated liver enzymes. In rare cases, it has been associated with a dangerously low white blood cell count, low platelet count, and hair loss. Uses. Mebendazole is used to treat intestinal worm infections such as pinworm, roundworm, and hookworm. Thiobendazole. Description. Thiobendazole is a white to off-white odorless powder with a molecular weight of 201.26, which is practically insoluble in water but readily soluble in dilute acid and alkali. 2-substituted benzimidazole first introduced in 1962. It is active against a variety of nematodes and is the drug of choice for strongyloidiasis. It has CNS side effects and hepatotoxic potential. Mechanism. The precise mode of action of thiobendazole on the parasite is unknown, but it may inhibit the helminth-specific enzyme fumarate reductase. Kinetics. Rapidly absorbed and peak plasma concentration is reached within 1 to 2 hours after the oral administration of a suspension. Some systemic absorption may occur from topical preparations applied to the skin. Metabolized almost completely to the 5-hydroxy form which appears in the urine as glucuronide or sulfate conjugates. Side effects: gastrointestinal, anorexia, nausea, vomiting, diarrhea, epigastric distress, abdominal pain, jaundice, cholestasis, parenchymal liver damage and hepatic failure. See warnings. Central nervous system: dizziness, weariness, drowsiness, giddiness, headache, numbness, hyperirritability, convulsions, collapse, confusion, depression, floating sensation, weakness, and lack of coordination. Special senses: tinnitus, abnormal sensation in eyes, xanthopsia, blurred vision, reduced vision, drying of mucous membranes, mouth, eyes, etc., Sika syndrome. See warnings. Cardiovascular, hypertension. Metabolic, hyperglycemia. Hematologic, transient leukopenia. Uses: for the treatment of strongyloidiasis, threadworm, cutaneous larva migrans, creeping eruption, visceral larva migrans, and trichinosis. Praziquantel. Description: praziquantel is an antihelminthic used in most schistosome and many cestode infestations. Mechanism: praziquantel works by causing severe spasms and paralysis of the worm's muscles. This paralysis is accompanied, and probably caused, by a rapid Ca2+ influx inside the schistosome. Morphological alterations are another early effect of praziquantel. These morphological alterations are accompanied by an increased exposure of schistosome antigens at the parasite surface. The worms are then either completely destroyed in the intestine or passed in the stool. Kinetics: praziquantel is well absorbed, about 80%, from the gastrointestinal tract. However, due to extensive first-pass metabolism, only a relatively small amount enters systemic circulation. Praziquantel has a serum half-life of 0.8 to 1.5 hours in adults with normal renal and liver function. Metabolites have a half-life of 4 to 5 hours. Praziquantel and its metabolites are mainly excreted renally, within 24h after a single oral dose. 70 to 80% is found in urine, but less than 0.1% as the unchanged drug. Praziquantel is metabolized through the cytochrome P450. Side effects: side effects may include poor coordination, abdominal pain, vomiting, headache, and allergic reactions. While it may be used during pregnancy, it is not recommended for use during breastfeeding. Praziquantel is in the antihelminthic class of medications too. It works partly by affecting the function of the worm sucker. Uses: this medication is used to treat infections of certain parasites, such as schistosoma and liver flukes. Curing parasitic infections helps to improve your health and quality of life. Oxamniquine. Description: an antihelminthic with schistosomicidal activity against Schistosoma mansoni, but not against other schistosoma species. Oxamniquine causes worms to shift from the mesenteric veins to the liver where the male worms are retained. The female worms return to the mesentery, but can no longer release eggs. Mechanism: oxamniquine may associate with an irreversible inhibition of the nucleic acid metabolism of the parasites. A hypothesis has been put forth that the drug is activated by a single step, in which a schistosome sulfotransferase enzyme converts oxamniquine into an ester. Subsequently, the ester spontaneously dissociates. The resulting electrophilic reactant is capable of alkylation of schistosome DNA. Kinetics: well absorbed orally. Peak plasma concentrations are achieved 1 to 3 hours after a dose, and the plasma half-life is 1.0 to 2.5 hours. It is extensively metabolized to inactive metabolites, principally the 6-carboxy derivative, which are excreted in the urine. About 70% of a dose of oxamniquine is excreted as the 6-carboxy metabolite within 12 hours of a dose. Traces of the 2-carboxy metabolite have also been detected in the urine. Side effects: headache, dizziness, or drowsiness, or abdominal pain, decreased appetite, or vomiting. Stop taking oxamniquine and seek emergency medical attention if you experience an allergic reaction, swelling of your lips, tongue, or face, shortness of breath, closing of your throat, or hives. Rarely, seizures have occurred, most often in patients who already have epilepsy or another seizure disorder. Seek medical attention in the case of a seizure. Uses. Oxamniquine is used for treatment of schistosomiasis. According to one systematic review, praziquantel is the standard treatment for S. mansoni infections and oxamniquine also appears effective. Vinylpyrimidines, Pyrantel. Description. Pyrantel is a pyrimidine derivative antihelminthic agent for the oral treatment of various parasitic worm infections including ascariasis, hookworm infections, enterobiasis, pinworm infection, trichostrongyliasis, and trichinellosis. Mechanism. By promoting the release of acetylcholine, inhibiting cholinesterase, and stimulating ganglionic neurons, Pyrantel serves as a depolarizing neuromuscular blocking agent in helminths. This causes extensive depolarization of the helminth muscle membrane, resulting in tension to the helminth's muscles, leading to paralysis and release of their attachment to the host organism intestinal walls. Kinetics. Pyrantel is poorly absorbed from the GI tract of humans. Peak serum concentrations occur 1 to 3 hours after a single dose. Pyrantel is administered orally. The poor solubility of the pamoate salt offers the advantage of reduced absorption from the gastrointestinal tract and allows the drug to reach and act against parasites in the large intestine. Metabolism of Pyrantel is rapid. 22. The absorbed drug is partly metabolized in the liver. Approximately 50% of an oral dose is excreted unchanged in feces, 7% excreted in urine as unchanged drug and metabolites. Side effects. Nausea, vomiting, abdominal cramps, diarrhea, or a decreased appetite, headache, drowsiness or dizziness, insomnia, or a rash. Uses. For the treatment of enterobiasis including roundworm, ascariasis, pinworm, enterobius, and hookworm, strongyloides, and hookworm, ancylostoma, in the Pyrantel pamoate formate. Pyrantel is available in various formulations for humans, dogs, and cats as the pamoate, U.S. Pharmacopoeia nomenclature, or ombinate, European Pharmacopoeia nomenclature, salt, which contains 34.7% Pyrantel base combined with pamic acid. Arnide derivatives. Niclosamide. Description. Niclosamide is an antihelminthic used for the treatment of tapeworm infections. Helminths, worms, are multicellular organisms that infect very large numbers of humans and cause a broad range of diseases. Mechanism. Niclosamide works by killing tapeworms on contact. Adult worms, but not ova, are rapidly killed, presumably due to uncoupling of oxidative phosphorylation or stimulation of ATPase activity. The killed worms are then passed in the stool or sometimes destroyed in the intestine. Niclosamide may work as a molluscicide by binding to and damaging DNA. Kinetics. Niclosamide appears to be minimally absorbed from the gastrointestinal tract. Neither the drug nor its metabolites have been recovered from the blood or urine. Side effects. Signs and symptoms associated with niclosamide therapy, though infrequent, include nausea and vomiting, abdominal discomfort including anorexia, diarrhea, drowsiness, and dizziness. Those of lesser frequency include constipation, headache, irritability, rash including pruritus ani, alopecia, oral irritation, fever, rectal bleeding, bad taste in mouth, sweating, palpitations, edema of an arm, and backache. Uses. For the treatment of tapeworm and intestinal fluke infections, Taenia saginata, beef tapeworm, Taenia solium, pork tapeworm, Diphyllobothrium latum, fish tapeworm, Phaseolopsis busci, large intestinal fluke. Niclosamide is also used as a molluscicide in the control of schistosomiasis. Natural products, ivermectin. Description. Ivermectin is used to treat infections in the body that are caused by certain parasites. Ivermectin is currently being investigated as a treatment for coronavirus SARS-CoV-2, which is the virus that causes COVID-19. Mechanism: ivermectin causes an influx of Cl ions through the cell membrane of invertebrates by activation of specific ivermectin-sensitive ion channels. The resultant hyperpolarization leads to muscle paralysis. Mechanism for resistance: widespread use of ivermectin for treatment of intestinal nematode infections of sheep and goats has led to the development of drug resistance in veterinary practice. Reports have emerged from West Africa pointing to a reduced effect of ivermectin in onchocerciasis. Resistance may be associated with alterations in P-glycoprotein gene expression. Kinetics: ivermectin is rapidly absorbed with Cmax is proportional to dose, with a value of approximately 38 to 46 g/L reached after a therapeutic dose of 150 to 200 g/kg. Estimates of the terminal half-life of the parent drug range from 28 to 56 hours. Side effects: in the absence of parasitic infection, the adverse effects of ivermectin in therapeutic doses are minimal. Adverse effects seen in filarial infections include fever, myalgia, malaise, lightheadedness, and occasionally postural hypotension. In onchocerciasis, skin edema, pruritus and mild eye irritation may be seen. Uses: ivermectin is active against most nematode parasites. It can also be used in the treatment of arthropod ectoparasite infestations such as scabies. Its principal indications are for treatment of onchocerciasis and strongyloidiasis. Additionally, it shows useful activity against a number of other helminth parasites, particularly Ascaris lumbricoides. Nitroderivative, nirintazole. Description: nirintazole is a schistosomicide. It is used to treat schistosomiasis, the helminthic disease caused by certain flatworms, trematodes. Mechanism: nirintazole is rapidly concentrated in the parasite and inhibits oogenesis and spermatogenesis. The compound also inhibits the phosphofructokinase enzyme, leading to glycogen depletion and hepatic shift. Kinetics: orally administered nirintazole is well absorbed, it is metabolized in the liver and eliminated largely and almost equally in the urine and feces. Side effects: nirintazole has central nervous system toxicity and can cause dangerous side effects, such as hallucinations. Also, it may cause allergic reactions in sensitive people. Uses: nirintazole is a nitrothiazole antihelminthic agent used to treat schistosomiasis. Its antibacterial activity was found to require the presence of the nitro group, a synthetic des-nitro analog was completely inactive. Imidazothiazole. Levamisole. Description: it is an antihelminthic which is active against most tapeworms. It was the drug of choice for tapeworm infections but has now largely been superseded by praziquantel. Mechanism: adult worms, but not ova, are rapidly killed due to inhibition of oxidative phosphorylation or stimulation of ATPase activity, resulting in energy depletion. Kinetics: levamisole is readily absorbed from the gastrointestinal tract and metabolized in the liver. Its time to peak plasma concentration is 1.5 to 2 hours. The plasma elimination half-life is fairly quick at 3 to 4 hours, which can contribute to not detecting levamisole intoxication. The metabolite half-life is 16 hours. Levamisole's excretion is primarily through the kidneys, with about 70% being excreted over 3 days. Only about 5% is excreted as unchanged levamisole. Side effects: side effects may include abdominal pain, vomiting, headache, and dizziness. Use is not recommended during breastfeeding or the third trimester of pregnancy. Uses: used to treat parasitic worm infections. Specifically, it is used for ascariasis and hookworm infections. Thank you for watching video and subscribe for more.